One of the biggest health issues the incoming president will have to tackle is the opioid epidemic. At a time when deaths from heroin overdoses have surpassed those of gun homicides, the price of the drug that can reverse an overdose is on the rise, and that increase in cost squeezing our first responders. Meg Tirrell has the first part of our series, Drug Price Crisis.
Firefighters in Farmington, New Mexico carry 4 essential life-saving medicines: aspirin, albuterol, epinephrine, and naloxone.
These are the most important medications and the only medications that we carry here at Farmington Fire.
Medicines that can mean the difference between life and death. And for some, their cost has been a problem. Farmington Fire is switching away from the EpiPen, planning to carry vials of epinephrine instead. But for another medication, the least expensive option has still been on the rise: naloxone for opioid overdose.
It's up to almost $60 a dose right now. In years past, Narcan was, $15, $20 a dose.
The increase fits a pattern set by many older medicines in recent years. Despite being on the market for decades with varying levels of competition, some generic medicines have risen in price, often exponentially. Manufacturers cite increased costs, investment in research, and market dynamics. For naloxone, these increases have coincided with the explosion in opioid overdose in the United States. Last year, opioids, including prescription painkillers like Oxycontin, as well as illegal drugs like heroin, killed more than 33,000 people in this country. Deaths from heroin overdose alone have now surpassed those from gun homicides.
We deal with overdose issues on a daily basis.
Originally introduced in 1971, naloxone acts as an antidote to opioid overdose. One study found that from 1996 to 2014, it reversed more than 26,000 overdoses in communities, not including countless more in hospitals. Like San Juan Regional in Farmington, where emergency physician Dr. Eric Ketchum
Is that the tar heroin?
confronts the issue daily.
Naloxone is an absolute vital medication for us in the emergency departments. It's a vital medication to our EMS personnel.
Increasingly, public health experts want naloxone in the hands of as many people as possible, especially first responders who use it to save lives.
Naloxone would provide our officers that first response to those situations where we might have an opportunity to save a life, plain and simple.
There are multiple forms of the drug on the market, and each has its own cost story. Those stories are playing out across America, from communities like Farmington to big cities like Baltimore.
Naloxone has actually tripled in price for us. We're experiencing not only in price but also in call volume, so we're actually using more Narcan. It has greatly increased our budget.
For first responders, that often means making hard choices.
If our medications cost more, then that's less money available for us to buy to upgrade bags, for instance, or to upgrade different things that we may choose to or want to.
Or sometimes not being able to carry naloxone at all.
There's just no way for any of the agencies to afford it right now. There's no way for us to put naloxone in every vehicle based on its cost right now.
It's a struggle that puts budgets and lives in the balance. For Nightly Business Report, I'm Meg Tirrell.